In this episode of the Leader Smith podcast, Scott Pearson, the economist from Palm Beach Atlantic University, will be joining us again. And we'll be talking about whether we should open or not reopen or what the pros and cons are. So stay tuned.
In a world of incompetent bosses, micromanagers, and petty tyrants, you are listening to The Leader Smith. Now, here is your host, Darren Gertis.
Okay, so with me again on the program is Scott Pearson. He's an economist at Palm Beach Atlantic University, and we're going to be talking about the best arguments for reopening or not reopening businesses, schools, those kind of things, the hidden costs. And so I'm going to frame it to you like this, Scott. Tell me this. If you were having a debate in class, I want you to set this up in such a way that as if you were having a debate in class, what would be the best arguments for reopening and for not reopening, for wearing masks or not wearing masks, that kind of thing? How would you do that? Take this away.
Wow, that's a big question. I'll do what I can. I think so. Let's talk about reopening first.
Okay.
Reopening the economy, people look at as a challenging question. This one I don't find as challenging, simply because the evidence that closing down an economy has some impact on the virus just really hasn't been developed. I haven't seen a lot of evidence that suggests that blanket shutdowns are effective.
Okay.
Now,
but you're talking about within each city in particular hotspots that works.
I was just going there. So I think targeted shutdowns, and by that I mean perhaps in a certain city where we have a hotspot, or for a certain type of event, large public events and things like that. I think you can find some evidence for things like that. My concern, and I think one of the arguments that I would make against the full-scale shutdowns that we've been experimenting with, is that you don't realize some of the things that end up being shut down, and the impact of some of those shutdown items, such as healthcare, such as research, are enormous, and enormous in ways that we can't really begin to fathom. So certain kinds of research have been set back 6 months. And that sounds unimportant to most of us that aren't involved in that kind of research. But imagine, if you will, that cancer research might be set back 6 months. And so 6 months of future benefit in fighting cancer has been delayed. And we've talked before about the statistics of how large an impact cancer deaths are on our society. So I guess my point is, you have to weigh, anytime we're talking about any action that we take, we have to weigh the positive against the negative, right? When we talk about shutting down a whole economy, we're talking about things that are being shut down that we really haven't had a chance to fully think through. And so I think that in itself is a very risky thing. Now, if we talk about shutting down a particular industry, if we talk about shutting down schools, if we talk about shutting down restaurants, if we talk about shutting down concert venues, that's a different case. And I think you can make that more of a pro versus con discussion, because we have a way we can fathom what the impact of each individual item is. But blanket shutdowns, to me, are very dangerous and very hard to measure.
Okay,
because
so let's rule out blanket shutdowns and go to, by state or city or wherever the hot spots are. Is it okay to shut things down, or is that? I mean, I'm looking at Q2. The economy took it in the teeth. It was something like a third lower GDP than normal. I mean, that is crazy, and that has a huge cost too.
That has an enormous cost, and again, I think those are costs that we won't fully understand until sometime in the future, because those are resources that we don't have to put into things like cancer research, to put into education, to put into all of the things that we value as a society.
Okay,
so the impact of that is going to be bigger than we probably imagine economically. But on the other hand, I'm not sure that the shutdown in a city, let's say, that is in the throes of a pandemic, that where there's a massive infection spread, I don't know a lot of people are going to be going out anyway.
Hmm.
And in fact, what we saw in our community, and I can't speak for other places, but in our community, uh, we essentially shut down 2 weeks before anything legally was shut down.
Uh-huh.
People were already working from home. People were already wearing masks. People were already staying out of public venues. Now, I'm sure there were people that were still going out, and even after the shutdowns, we segregated people into essential and non-essential in some silly thing that I think is, again, hard to really do in any kind of sensible way. But there were still people going out, right? Uh, but for the most part, most of what's going to happen in terms of people choosing to not go out into the city in terms of a pandemic is going to happen anyway, whether we make a legal restriction or not.
Hmm.
So I question how big that impact is going to be, but it does have some. I think it's probably important for uh, community leaders to come out and make statements and help everybody to understand that there is a serious pandemic and it's spreading in our particular community, and so we need to be cautious. We need to be extra careful with hygiene. We need to be limiting our trips and limiting our contact with others. That sort of makes sense. The problem with making it a legal requirement is that it forestalls people from making what I would argue are appropriate choices.
Yeah,
So
interesting.
if you have uh, a loved one who's dying, do you go and visit them? Well, I think you would make that calculus. You would make that calculation, and you would decide probably, certainly the risk to them is minimal since they're dying anyway, and the risk to you, if neither of you are infected or you don't believe you are, is going to be minimal as well. Now we don't know that, but here again we have this misperception of risks, right? We overstate certain risks, we understate other ones, and we really don't fully understand all of the things that are going into it. Anytime we're making a decision about what we should do in a pandemic, there has to be some educated calculus. We have to be able to make choices based upon the mix of risks on both sides. So we have to be able to quantify what's the risk of a particular activity. Is me visiting one individual a high risk activity?
Yeah.
If I had a family member who I knew was suicidal, and I knew that personal contact would minimize their mental health risk, would I go and visit them?
Yeah.
I would. And I think that would be a wise choice, because the positive impact that I could have from that one visit would be greater than the risk of spreading the virus from
Yeah.
that one.
So that made me think of a couple things. So one, the cost in human, like depression, suicide, all those other things. As you were talking about, the cost of cancer research, I had never thought about the cost of cancer research, right? So I'm glad you brought that up. That wasn't where my mind was, but I was aware of depression rates have skyrocketed, suicide, those kind of personal costs are all there. And then the other thing that I was thinking as you were talking was, I was reading George Gilder, and he was talking about, look, with the index fund, you learn nothing, right? All you're doing is riding along on the coattails of whatever the economy's doing. It's not bad, but you're not learning. There's no new knowledge being gained, and knowledge is
Yeah.
what's actually helping you grow and develop. Same kind of thing here. When the law is doing what, so you pointed this out just now. When a law is made, that's forcing you to do this thing, which is different than you making your choices independently. So I guess that's also part of what the pull is between people that are like anti, don't wear a mask, or the crowd that's saying don't wear a mask, don't listen to the government telling you. And when at the same time, I think we could avoid what I've read, if you simply are, if both sides are wearing a mask, which the mask isn't really doing a lot, but it's doing something. right? And you're staying 6 feet apart. And the mask, more than anything else, reminds me to stay away from people, right? I see them and I go, oh, yeah, I probably ought to stay a little bit farther back than otherwise. But I think it probably does more for that than it does to keep any germs from coming through. But let's say if you just do these things, wear the mask, everybody's wearing the mask, and you social distance, it has the effect of doing what the shutdown was trying to do, but it's not nearly as laborious. Now, I don't know that that's true, but it certainly seems reasonable that that is what, or that that it's having a mitigating effect. But the people that react are reacting because I don't like that big government is telling me to, I must do this. Can you speak
It's
to that?
interesting to me. I think we see stronger reactions almost to the mask mandates than we did to the shutdown, which I find
Bizarre.
puzzling and troubling.
Yeah.
Because the shutdowns have had. I mean, we're talking about millions of people being put out of work, and this is a worldwide phenomenon, right? And we're in developing world countries, we're talking about people that are being put on the brink of starvation.
Yeah. Wow.
Because of access to food. It's just an enormous cost. And the benefits haven't yet been proven. We haven't done this. This is not a historical thing that we always shut down in the midst of a pandemic. This has never been done before.
Yeah.
We have shut down schools before. We have shut down social events before. But we've never shut down whole economies. And there's a reason for that, because in history, people knew that they couldn't afford to do that. We've become wealthier today, and we think we can get away with shutting down an economy. I don't really think we can. I think that's a price we're going to be paying for a long time. But I don't think we're fully going to understand the cost of that.
So in February, I understand that. I mean, in late February, when we're going like early March, hey, we got to shut down. We didn't know what we were dealing with, and we thought that this was a lot worse. But right now, I mean, now we're into August. We should be kind of, we should have a lot more knowledge about what we're dealing with and how to go about dealing with it properly now than we should have had then.
But here's the problem, and I think you alluded to this before. Since we were shut down, it kind of prevented us from getting that a lot more knowledge.
No,
we didn't have the ability to learn during that time. I mean, we could have learned. Some people may have learned, but I think it kind of prevented us from going through, learning is a process of making mistakes and learning from them. And I mean, mistakes are costly in times like this, so I understand why people are afraid of that. But the reality is, until people learn and make judgments and make mistakes and grow from those, we're not going to move forward. And so now we haven't really done a lot of learning. We've done a lot of following instructions.
Yes.
And as a society now, we're kind of in the early stages of decision making. So I'll talk about schools for a second, because I think schools, it's, to me, it's not as problematic as some things. If we shut down schools, people can still learn. It's a problem that sometimes people are looking for daycare for their kids and they don't have a place to put them, and they have a 2-income family and they both are in, let's say they both work in healthcare, they're both going to be working.
Yeah.
So something has to happen. But can people learn for a period of time without going to a school building? Sure they can. We know they can. But there's trade-offs there too, right? And I have a friend who has made the decision this year that they are going to, they're in a school district where they have a choice of whether to send their kids to the school or to keep them home. And they made a decision, even though they're not, homeschooling family at all, they made a decision to keep their kids at home and work with them from home, because they're in a position that they can do that financially and so forth. And they thought about this and they said, well, that's going to free up more space in the school for those people that don't have a choice, for those people that don't have alternatives, and they can be distanced better in the limited space that they have available. There's going to be less people using those resources. And I think this is how we need to be thinking about things. We need to be thinking about, what can we do to reduce the burden on others? What can we do to adapt in ways that make sense for us today? So I find the discussion about should schools be 100% shut down, or should they be 100% open? And one team is throwing out, well, I want to make sure all the schools are open. And the other team is throwing out, I think all the schools need to be closed. And I think those are both extreme answers.
Yeah.
The real answer is we need to let people choose. We need to encourage them to find alternatives when they can. But if they can't, it would be good for there to be an alternative. Because you know what? If they're a 2-income family, they're both working in healthcare, they both have to work, their kids are going to go somewhere. And if they're not going to school, they're going to go to daycare. And you're not going to tell me that they're going to be safer in daycare than they are in school. So, provide as many alternatives as you can, make those alternatives as safe as you can, and encourage people to take advantage of safer options like, distance learning and homeschooling and things like that when you can.
Yeah.
Help people to adapt. Don't just yell orders. Help people to find best practices and best answers.
So it struck me as you were talking that part of where we are is because, and we have to factor this in, the legacy of where we've been. Okay. And what I mean by that is, so we're dealing with, should schools open or not? Like it's binary when, okay, you have multiple answers, but before that, the answers are predicated on what's happened before. So, I'm at CSU and we're dealing with, how do we space out the number of people in a classroom so that we're appropriately socially distanced within a classroom? But our classroom spaces were, and this is a public schools problem too, were not built so that we could socially distance. It was built to cram in as many people as possible into the space, and that's what we assumed going into every other school year before 2020.
Right.
But now we have a problem. Like we had like something like 20 classes in the College of Business alone, that the class size was too large once you socially distance, or the class size wasn't large enough rather once you socially distance. So now we're trying to find alternative classrooms or hybrid or put these classes online or whatever else, because the previous assumptions that worked now do not work. It's the same way with the public system. We were trying to push everybody into a one-size-fits-all public system, and we would kind of hold our nose and say, oh, well, if you want to go to that private school, you pay for it, and if you want to do that, but we have this free system. And trying to push people into that system. But that system now is going to be a problem. New York City is a great place to be for economies of scale for many, many things for the rest of life. But in 2020, it became a hotbed because everybody was jammed in, right? You had everything within walking distance when you lived there before, but now that same thing is working against you. So the previous systems were actually kind of causing where we are. Does that all make sense?
Mm-hmm.
So when we get to something like answering the question of should schools open or not, I think your answer is spot on when you're saying choice. Let people, find what works for them. And let me say one more thing before I ask you again. So we can't just say, oh, everybody go. We can't give a one-size-fits-all answer. Everybody come, everybody go. If we say everybody go home, then you're going to have people so some people don't have a computer at home. And the poorest are going to be the two-parent family or the one single mom that has kids that doesn't have internet access. Those people are going to fall through the cracks.
Exactly.
So if you then allow choice, what you have is those people that are going to fall through the cracks can still go, and it's thinned out because other people can go home and be online at home and feel safe there. So you're actually creating a greater or multiple greater environments for people to have what they need if you create choice. And I'll let you talk from there.
Well, I think the point is that in all of these questions, and we have lots more questions to answer than we ever had before, because we're having to make decisions about things that we just took for granted. We have to make a decision about, do I go to the grocery store or not? Mm-hmm. I mean, that's not something that we used to be conscious about. And now we're having to decide that. We have to make a decision about whether we get our hair cut or not. And it's a very controversial one. It doesn't need to be controversial, but it is. And we've made everything into a really challenging decision. Well, here's the thing. Everybody has trade-offs. Mm-hmm. Everybody has decisions that they have to make, and your trade-offs are different than mine. Your risk of sending your child to a public school building is different, perhaps, than mine is different than it is for another party. And so we all have to really be able to make those choices based upon the conditions that we're facing. If I have in my household a family member who is at high risk for the virus, then sending my child out to the public school may be a riskier equation than it is for somebody else. If I don't have that, and the case we talked about where we have the two-parent family where we're both working outside the home in jobs where what I do is essential and we really can't afford to give up either of those, then sending my child to a public school seems like an essential activity for me. Now, it comes to the same thing when we get to how are we going to adapt to these various needs. You have school teachers right now that are afraid to go teach, that they're at risk. But you have other school teachers that know that they're not. Should some of these be set up to do distance learning and other ones be prepared to go into the classroom? I think that makes sense. But everybody is in a different situation. And this is one of the mistakes that I think we've made during this pandemic. We have this mindset, well, we're all in this together. And yeah, we sort of are, but we're all starting in a different place.
Yeah.
I feel really blessed in that we're in a situation where we've been able to adapt and I can work from home and most of things that we've had to make some choices and we've had to give up some activities that we would have liked to have done, but we just, we know that that's not the right thing to do right now. But for the most part, our life hasn't been that impacted. But I also know that if this had hit me at a different point in my life, it would have been a very serious challenge and there would have been a lot of issues that we'd have to resolve. And everybody's in a different situation. And we need to be respectful of that. We need to be mindful of the fact that not everybody's making the same choices that you and I are. So we need to be able to give people choices to make the calculus, make the decision about what's going to work best for us.
So to summarize, you're saying that everything should reopen or everything should close down?
Ha! So, I don't believe in the blanket shutdown. I think that's a dangerous thing, and I think it's dangerous in ways that we can't fully evaluate. I don't believe that we should open up, public parades and things like that, because that doesn't make sense either.
Sure.
I mean, I don't think, all the 4th of July fireworks displays in the area were canceled. And we bought a few fireworks and shot them up in the backyard, and that's fine. Actually, the kids said it was the best 4th of July ever because, we got to do it ourselves. So it's funny what people appreciate, but it's not a blanket thing, and we can't make a blanket decision. Are there things that probably we should make choices not to open up right now? Sure, I think that makes sense. But to say everything has to shut down, no, I think that's a very dangerous idea.
Okay, so I'm going to give you the quotation for contemplation for today, and then I will be interested in hearing your prediction of what might happen in the future. So as we move out of this, are we going to move out of this quickly? Are we going to move out of this? It's going to take a couple months. It's going to take a year. It's going to take years. Hold on that thought. Here's the quotation for contemplation for today. It's from the great leader Andy Rooney. Okay, he said this: the 50-50-90 rule. Anytime you have a 50-50 chance of getting something right, there's a 90% probability you'll get it wrong. How you like that? Okay, with that, I'm going to ask you for your predictions. What do you think will happen? Will we pull out quickly, slowly, long term? What do you think?
So there's a few different levels that we can answer that on. I mean, economically, the V-shaped recovery, I think that's not going to happen. And I think we've already proven that that's not happening, right? We didn't just immediately turn around. And that's simply because we have the overhang is still there. People are still uncertain about how the virus is going to work and how we're going to live through it. That said, there's a lot of adaptation going on. The sooner we can learn and adapt and figure out how to live with this different world, the sooner we can recover. And so I see a lot of people finding alternative ways to do schooling, to do meetings, to do life. And that's a healthy thing. That's a positive thing. And that suggests that certain parts of the economy are going to move relatively well in the longer term. But it takes time to adapt. It takes time to learn. It takes time to recover. A second factor that we really haven't yet calculated in is that a lot of what's going well now is going well based on borrowed money.
Yeah.
We're doing a lot of spending programs and ginning up the economy. Those kinds of things eventually you're going to have to pay the price for.
Yeah.
And I think we really aren't facing up to that yet. So that's a second shoe that's going to drop sometime, maybe later this year. That does not bode well.
Yeah, I don't see any way around that. I mean, I was optimistic early on. I was like, okay, but if we can get out of this thing quickly and become the producer to the world, we can grow our way out. I don't see that scenario anymore. I just see that we're going to be watering down our currency even further and have more massive debt, and that's going to cost us. And that bottle of Coke that's $1.25 at Walmart now is going to be $2. This time next year.
It's hard to know how fast these things are going to go. It's hard to know how fast prices are going to rise, but I think they will. Mm-hmm. It's hard to know how fast the economy is going to recover. Eventually it will. But there are certain things that are kind of baked in. And most of those are things that Americans aren't prepared for emotionally.
Yeah.
And I think that's probably true in other parts of the world as well. And so that's going to lead to some discomfort and probably some unrest.
Yeah.
And that's going to feed into some other negative outcomes as well. So, I mean, there's a lot of this
the dislocation of certain businesses. I mean, if you were in the concert business or you're in the restaurant business, I did this episode the other day about how a third of New York City small businesses they're just going under. Well, if you're already on razor thin margins, I get it. So there's going to be a huge amount of dislocation. But as far as pulling out of this, I think long term we're going to have to pay that financial cost. But it's a good question whether we're going to be able to get out of this and kind of resume normal, with schools reopen and that kind of thing, or if we're going to see instead of a V, a W, or some kind of Charlie Brown squiggle.
So normal is going to be different. And I think the sooner we face that we're going to have to do some adapting, and the sooner we recognize that, I think restaurants will survive, but I think there's going to be a lot fewer of them, and I think they're going to be different than we have experienced in the past. Mm-hmm. And the sooner we face that, the sooner people handle that dislocation and adapt, and a large number of people move out of that industry into other industries, the sooner we're going to be prepared and we're going to start to recover. Unemployment is going to happen. Yeah. I don't like it, and I don't want to. I've discouraged the policies that lead to it, but some is going to happen anyway. Even if we handle everything perfectly, there's going to be some changes to the way you and I and everybody else goes about life, right. And that's going to change. That's going to cause some dislocation, but we can adapt to dislocation if we are prepared for it, if we know it's coming, and I think this third one's important, if we don't try to cushion the blow too much. And I think one of my fears, we did this in 2008, and I think it caused the recovery to come more slowly then. And we do this in government. We try to cushion the blow, and we try to make it easier on people and make them feel good and make them think that everything's okay. Because I think governments have an incentive to do that. But the reality is everything's not okay.
Yep.
And the sooner we face that reality and adapt to it and move on, the sooner we're going to recover.
All right.
I don't see us doing that right now, and that's my greatest fear.
Yeah, that's kind of where I am too. I think this is going to be longer, but not for the reasons of necessarily of the virus, but because of the policies and decisions that are being made in order to try to make it better, we might be making it worse. Hey, Scott, thank you so much for your time coming on the program and your insight. And I hope that helps people that are listening to make better decisions for themselves personally and helps them become the kind of leaders that they would want to follow.